afternoon. I am Juan Arostegui from Barcelona, and first of all, I would like to thank to the Data2 Foundation and Dr. Chip Chambers for their invitation to share our experience in Spain. I have nothing to disclose, and this will be the agenda of the talk. I think it's important to introduce our unit. We are located in Barcelona, in the northeast of Spain, and the data I will introduce in the next slide are our own experience. However, the Spanish Data2 cohort is probably bigger than our data because for different reasons, I know that there are other families in Madrid, in Sevilla, in Almeria, in Valencia, also in Barcelona. So probably the number of positive Data2 families are around 24 in total. Well, as you know, the genetic basis of the ADAH2 deficiency was published in 2014 by two seminal papers, and at that time we decided to include the testing of the ADAH2 gene in our NGS panel. So we systematically analyzed all the samples we have received in the lab for suspicion of autoinflammatory disease. That means more or less 5,000 different individuals. But our activity in the lab started in 1998, and we have all the samples in the freezers. So we were able to retrospectively analyze more or less 100 candidate patients. Obviously, we perform a genetic analysis and we identify gene variants, but I would like to focus only in variants classified as pathogenic, likely pathogenic, or variants of uncertain significance. We have identified 48 individuals with this kind of variants, 60 individuals with biallelic variants, and a large group with 32 individuals with monoallelic variants. So I will show you right now the Spanish families with biallelic variant. These are the pedigrees. 12 families, 15 affected individuals, and one unaffected individual, 50 years old male, identified in the family 12. The message, or the most important message regarding the pedigrees are the next. With, as you know, the consanguinity is a risk factor for recessive inherited disease. Interestingly, we only detected one family with consanguinity and one family for Roma ancestry, people or ethnic group who that have a Greek endogamy. With regard to the genotype, we identify 4 homozygous genotypes. Unexpectedly, in 3 of these families, there are no data that suggests consanguinity in the family. With regard to the number of affected individuals in the families, we have identified only 3 families with more than 1 affected individual. That means that most of the patients are sporadic patients with no familial history of the disease. And we have identified only 1 death patient. We received the samples for recurrent fevers in 2002, and this represents the first individual confirmed genetically of Data2 postmortem in our cohort. With regard to the clinical feature, these are the Data2 clinical spectrum, and these are the individuals, 16 individuals with biallelic variants. Most of them, 13 patients, have the pan-like or pan-like plus stroke phenotype. more or less 50% are female and 50% are male, as expected for an autosomal inherited disease. The age at disease onset is very early. The median is 6.5 years, and the most important is around 85% of individuals started during the first decade. With regard to the clinical manifestation, the fever, the skin lesions, and the neurological manifestation, especially in the central nervous system, are the most prominent. The cutaneous lesion, the most frequent cutaneous lesion detected is the livedo reticularis in 80% of individuals, and the nodular lesion was the second cutaneous lesion detected in 30% of the patients. With regard to the strokes, we identify them in 9 patients with 7 patients suffering from recurrent stroke. With regard to the type of stroke, we detect both ischemic, hemorrhagic, lacunar, and sometimes in the same patient suffer from more than one type of stroke, probably at different time. But all these data were recorded before the start of anti-TNF treatment. This is an important point. There are other more infrequent manifestations like hemorrhage of retina, or like bilateral kidney infarct in a patient that was published in 2014 as a patient suffering from polyarteritis nodosa, and myalgias, arthralgias, recurrent fever, and also neutropenia and hypogammaglobulinemia is relatively frequent in this phenotype. There are 2 patients with the hematological phenotype and 1 asymptomatic, and curiously, they belong to the same family. This family, the last one we identified, the 2 affected individuals start during the adulthood, the male at 34 years old, at the age of 34 years old, and the female patient during the adulthood, both in the form of a chronic idiopathic neutropenia with an absolute neutrophil count ranging from 30 to 800 neutrophils per milliliter. With regard to the bone marrow biopsy, in some instances, there was the identification of a nearly total absence of neutrophils. In the female patient, we also detect an episode of ischemic stroke. And as you can see in the pedigree, as consequence of the genetic analysis of the siblings of the Propositus case, we identify an individual carrying the B allelic mutation asymptomatic at the age of 50 years old. With regard to the ADA2 enzymatic activity, we are starting to do in collaboration with the Department of Biochemistry of the Hospital Sant Joan de Déu, a pediatric hospital in Barcelona. We have only a few data from our cohort, and you can see the data of these 3 patients from 2 families clearly deficient of the ADA2 enzymatic activity when compared with the healthy parents or healthy siblings carrying monoallelic variants. From a clinical point of view, we identify a different group, individuals with monoallelic ADA2 variant, 32 different individuals. Most of them carry or private of variants of uncertain significance in the ADA2 gene. There are 2 groups of mutation, some recurrent, like a mutation and the 49 residue of 489 residue. There are other less frequent, like the splicing acceptor site of the G47 arginine variant. The most interesting data among the group of monoallelic individuals are the next 2 families. Family 13 with a male starting in the adulthood with livedo reticularis with recurrent stroke, who was diagnosed of panarteritis nodosa with a clearly monoallelic pathogenic variant in the ADA2, with no data available on residual enzymatic activity, but with a high suspicion of DADA2. The other family came from the south of Spain, from Sevilla. This is a girl who started very early at the age of 15 months with livedo reticularis, with skin ulcers. We detect a monoallelic missense mutation, and in this case, the enzymatic activity is extremely low and compatible with the deficiency. In my personal opinion, these two patients may be diagnosed as having DADA2, but this, we did not identify the second hit, probably because the second hit is a gene structural variant that we lost with our genetic approach, and currently the whole genome sequencing of both individuals are in progress, and probably we expect to identify this second hit and to confirm the biallelic nature of the disease. And finally, with regard to the genetic disease in our cohort, in the top of the slide, you can see the genomic organization of the ADA2 gene. We have identified in the Spanish ADA2 cohort 13 different ADA2 variants, most of them located in the exon, with only one variant highlighted as a green star in an intronic region. 6 are novel, most of them are single nucleotide variants, and there are 3 recurrent mutations. And this is important, the recurrent mutation. This is the details of the mutation we detect. You can see in blue the novel mutation, but the important message is this. With regard to the recurrent mutation, the glycine 47 arginine and the splicing, the variant of the splicing acceptor site, have a moderate allele frequency in the genome database. So I personally expect to identify this mutation among healthy individuals, but also probably among patients with DADA2 in our population. And as conclusion, I would like to say that our group has identified 14 unrelated families with DADA2, but please remember that the Spanish DADA2 cohort is bigger than this data. Despite the consanguinity is a risk factor for recessive disease, we have detected a low degree of parental consanguinity. Most of the patients were sporadic patients with no family history of the disease, and most of them displayed the phenotype of panarteritis nodosa-like plus stroke. With regard to the genetic analysis, we have obtained or detected a high diversity in the gene with 6 novel variants, and currently most of patients are treated with a DNF with apparently no recurrence of neurological manifestation. And finally, I would like to acknowledge to our collaborators in the clinic, to the different hospitals around Spain, to the Department of Biochemistry in the Hospital Sant Joan de Déu, and our unit in the Department of Immunology that performed the genetic analysis. Thank you very much for your attention.